Hi, I'm Dr. Alan Wheeler and I'm the Director of the Cayman Islands Mosquito Research and Control Unit. We've been getting quite a lot of questions lately about the high number of mosquitoes, so I'd like to try and take a moment to answer some of the most common questions. First question is, why are mosquitoes so bad right now? The mosquitoes are bad right now compared to previous months, definitely compared to 2024, which was our best year on record. They are not quite as high as they were in 2023. So the mosquitoes are bad now. When I say they're not as bad as they were in 2023, that's based on the numbers we collect in our light traps. I have a graph here just showing the numbers over the last 3 years. So you can see here, the y-axis here represents the average number of mosquitoes collected per night. So back in May 2023, we were collecting on average 1,100 mosquitoes per trap per night, which is a major outbreak. And then from November 2023, we didn't really see mosquitoes again until October 2024 when we had a peak. Now we are in the middle of our biggest emergence of 2025. Our highest numbers we've seen so far are 600 mosquitoes per trap per night. Now that's an overall picture. It was going to vary depending on where you are, where you live. We realise that mosquitoes are very focal in their abundance, so one area of the island can be free from mosquitoes while another one can be seeing the worst year they ever remember. We do get that report every year that in some locations people are reporting mosquitoes are the worst they've ever seen. But the overall picture so far this year is, yes, it's much worse than 2024. It's not quite as bad as 2023. We don't know what's going to happen for the next few months. At the moment, the areas of the island that are seeing the highest mosquito activity, generally it would be north side that sees the highest mosquito numbers. We also see a lot in the area from Red Bay to Frank Sound Road. It can change overnight. I mean, what's bad today may not be bad tomorrow or next week. So the highest numbers it's really based on a day-to-day average. Grand Cayman, of the three islands, Grand Cayman has, in general, a considerably higher mosquito problem than either Little Cayman or Cayman Brac. The reason for that is the amount of mangrove we have. I think Grand Cayman is still about 50% mangrove, which is the preferred breeding site for the Ades mosquito. Now, Little Cayman also has a lot of mangrove, so they do have a higher mosquito problem than the Brac, which I'd say of the three islands, the Brac generally sees the lowest mosquito numbers. Question quite often comes up is that, are the high numbers we're seeing now related in any way to the genetically modified mosquitoes that were released a number of years ago? The last release, I believe, was in 2018. It's a different species completely. The release of the genetically modified mosquitoes was the Ades aegypti mosquito. What we're seeing now is the Ades taeniorhynchus, or the black salt marsh mosquito. Ades aegypti occurs domestically and breeds in and around houses. Ades taeniorhynchus emerges en masse from mangrove swamp areas. There's absolutely no way that this is related. What we're seeing now is related to any release of genetically modified mosquitoes many years ago. In fact, it was sterile male mosquitoes that were released. Male mosquitoes don't bite, so and they would not have been able to reproduce on the island. That was the whole idea of the release. Next question that we'll receive quite commonly is, how long do we expect it to take before the mosquitoes go back down? It's a dynamic situation. We're dealing with the environment. I can't predict what the rainfall is going to be from now till the end of the year. There's a strong association between rainfall and number of mosquitoes we see. Generally, after a heavy rainfall event, we'll see mosquitoes 12 days later. As you'll be aware, we've been having quite heavy rainfall, it seems to be non-stop for the last 4 or 5 months, which is the main reason we're seeing so many mosquitoes at the moment. It's not the actual amount of rainfall that's the issue, it seems to be the frequency. This year, rains seem to come, it seems to be constant within a 12-day period, so we've always seemed to be dealing with a fresh brood of mosquitoes. And I'm expecting further mosquitoes to be coming off over the following weeks. So once a brood does come off, it generally takes us 1 week or so to bring it back under control. Question, how does MRCU measure whether the current treatments are working effectively? Okay, to ensure our chemicals are actually killing mosquitoes, we'll carry out something called resistance tests, where we will test a dose that is confirmed to kill mosquitoes. Generally, it's confirmed by the CDC in the USA. We will confirm that dose is effective against our mosquitoes. Now, even if it's not effective, the dose we use in the field is quite commonly still effective. So we'll also carry out something called a cage mosquito trial. We've done quite a lot of resistance and cage studies this year, and all of our chemicals appear to be killing effectively. I've also looked at historical data this year just to confirm that we're not seeing any difference. So going back over the 20 years, the average reduction that we would expect that we've seen in our ground ULA operations has not changed significantly over the 20-year period. This means that we seem to be killing as effectively now as we were 20 years ago. How can the public be confident that the treatments being used are both effective and safe for people, pets and the environment? Okay, MRCU, we all live on the Cayman Islands, we all have a responsibility, we have our own families. None of us are going to be applying any chemical we consider to be dangerous for the residents of the Cayman Islands. In addition to that, all the products we used are certified as being safe for mosquito control by the US Environmental Protection Agency. All chemicals we use also have a product label which specifies the strict conditions under which chemicals can be applied. So they can only be applied up to a certain dose. We have to ensure that the droplet sizes that we're applying are the correct size. We also have to ensure that the wind speeds we apply in are the correct wind speeds. So there's a number of measures to ensure that these chemicals are applied safely. Is there a public health risk associated with the current mosquito population? The Ades taeniorhynchus mosquito is a known vector of arbovirus such as Venezuelan equine encephalitis. It's not present on the island, so it's an environmental risk, but it's not a threat at the moment because we've never seen that disease in Cayman. The biggest threat from Ades taeniorhynchus is the spread of dog heartworm. Now that is endemic on the Cayman Islands. It is transmitted at a high rate by this mosquito. So I would ask that any pet owner continue to give your pets, your dogs, the dog heartworm medication. That's the biggest health threat on the island. It's a veterinary threat. How do we determine when conditions are ideal for fogging or larviciding? Our applications can be affected in a number of ways by the environment. There's something called a heat inversion, where hot air coming up from the ground can prevent any insecticide applied by air reaching the ground. So we have to ensure that we're applying chemicals when that inversion is correct. We also, as I stated earlier, there are product labels that will tell you the minimum and maximum speeds that you can apply the chemical. You also want to be applying the chemical when the mosquito is most active, which is another consideration we need to make when we're applying our chemicals. Okay, the next question. With frequent rainfall, is it even possible to get ahead of the mosquito breeding cycle? This year's been difficult because the rainfall has, every time we've dealt with one mosquito emergence, it's followed immediately by another one. I don't know how long that's going to go on. It has to come to an end eventually. In the meantime, we will just continue to control mosquitoes to the best of our ability, using the chemicals that we know to be effective. Okay, so the question is, what does a typical day look like for MRCU crews during peak mosquito season? I'm proud of the crews we have at MRCU. I think they do an incredibly difficult job. One of the main things they will need to do is bring back field surveillance data during the rainy season. So this will typically involve going into the swamp areas of Grand Cayman to do something called a biting count, where they will stand and just count the number of mosquitoes biting them in a minute. They report that information into a field-based data collection app, which I can see in real time on the computer here, which will tell me where the main mosquito problem is. So each symbol means something different. So a dark blue background means that the area is sheet flooded. The green circle here indicates low numbers of biting mosquitoes, which means less than 5 bites a minute. There's one particular area of this markers where we're seeing very heavy biting rates, and also mosquito larvae, which would be the yellow cross in this case. So green is low biting is indicated by green colour, higher biting is indicated by the red number, intermediate is a yellow colour. So let's look at the big picture. So we have an issue. We currently have an issue with adult biting mosquitoes in the West Bay area, particularly around the fire station and Salt Creek. And overall, Georgetown is showing significant improvement compared to what it was. We still have a bit of a problem, or quite actually, let's call it a lot of a problem around the Patrick's Island prospect area, which we did treat that yesterday. So I'm hoping we'll see some significant improvement there today. And then our remaining hotspot area, I would say, would be north side. You see again the red circle indicating high numbers of biting adults, orange slightly less higher but still high. These green crosses here indicate more larvae coming off over the next few weeks. The only area of this that I can see considerable numbers of adults expected to emerge would be in the prospect area, which we will be sending teams in there to deal with that over the coming days. My crews also go into urban areas to control what we call domestic mosquitoes, which are Ades aegypti. Ades aegypti is the mosquito that transmits dengue. The crews go into yards that are at risk from a number of factors, one of the most prominent being dog attacks. When they go into a yard, people may forget to inform us that the dog is loose. So we have had incidents in the past where crews have been bitten. And then in addition to that, after a long day at work, our crews during peak mosquito season are then expected to go out and fog in the evening. So we do have a fatigue management program, but in peak season, our crews can be working in excess of 12 hours a day. So I thank them for that. Next question, how are known problem areas handled? We carry out various types of mosquito control. One of the most effective is the application of residual larvicides. So we have identified areas that we will apply larvicides that we will apply to swamp areas, and they will remain active for 30 days or so. There are other known breeding areas where we will treat when we survey. Typically during the rainy season, we will send survey crews out into the swamp at least twice a week, and they will, as I stated earlier, they will be conducting biting captures and larval dips to give us a good picture of where we need to be sending our control operations. Question, are there any new technologies or methods MRCU is testing to improve control efforts? We're always continually looking to improve our application methods. In recent years, we've introduced a machine called a buffalo turbine, which allows us to treat wide areas with a liquid larvicide formulation that's proven to be very effective. Our main new technology that we're working on at the moment is the use of unmanned aerial vehicles or drones. We're using them both for surveillance, and we are working towards, we have a larger drone now that can be used for aerial larvicide applications. Now that's going to help us a lot with some of the smaller areas of swamp on Grand Cayman. It's very difficult for our aircraft, which is travelling at about 125 miles an hour, to accurately deposit larvicide in some of the smaller areas of remnant swamp. With the drone, we should be able to hit these areas much more effectively. So it's not designed to replace the aircraft, it will complement our current aerial operations. What's been done to prevent mosquitoes from breeding after the next rainfall? Okay, we do a lot of residual larvicide, and we've done a lot this year compared to other years, much more, I believe, than any recent year. The residual larvicide purpose is to prevent the emergence of new mosquito larvae. We can't possibly apply it to all areas, so it's applied to areas where we find highest mosquito numbers. Now, unfortunately, in our most recent larvicide attempt, we were only able to get as far as the West Bay Peninsula before we had to shift control back to adult mosquito control. If we continued on the larvicide, people will be getting a lot more bites now than they currently receive, and so it's a play-off. We have to make a decision: do we target larvae or adults? And at the moment, the adults are so bad that we have to be targeting them. What advice do I have for people who spend a lot of time outdoors? If you have to be outdoors, wear long sleeve shirts, long pants, a good deep-based mosquito repellent. But the best way to avoid being bitten by mosquitoes is to be indoors during their peak biting activity. They have a very, very specific biting activity which commences 15 minutes after sunset. So that would currently be about 6:15 and will continue for about 2 hours after that. When mosquito numbers are particularly bad, like now, that period might extend into the late hours. They also have a secondary peak early in the morning, which will occur just after sunrise. Okay, next question I have is, can residents request special treatments if mosquitoes are bad in their neighbourhood? The simple answer to that is yes. Please report to us if you have a mosquito problem. It helps us coordinate our control operations, and we will do our best to respond within 24 hours. Now, during particularly high periods of mosquito activity, it may take a couple of days before we can actually get there. We have to prioritise based on where most of the reports are coming from, and also where our traps are telling us that the highest mosquito numbers. What kind of containers or items are most commonly overlooked as breeding sites? Okay, different mosquitoes have different breeding sites. The main mosquito that's causing the issue at the moment is Ades taeniorhynchus. That breeds in mangroves, mangrove areas. Now, the Ades aegypti mosquito is a domestic mosquito that breeds in and around houses in man-made containers, particularly buckets, flower pots, children's toys, discarded tyres, anything that can hold water. And then there's other mosquitoes such as the Anopheles mosquito, which is not particularly problematic for us at the moment. That will breed in permanent or semi-permanent ponds and pools. Now, in regards to controlling Ades aegypti, the question we often get is, how often should people walk their property and dump standing water? Typically in the Cayman Islands, it's going to take 8 to 10 days for a mosquito to go from larvae to adult. So if you can get around your yard once a week, looking in the type of containers I've mentioned, flower pots, buckets, children's toys, discarded tyres, anything that can hold water, if you can do that once a week, empty the water out, you should be able to control mosquitoes around your house. Now, the Ades aegypti mosquito has a very limited flight range. Typically, it's less than 100 meters. So if you experience a problem with this mosquito, more likely than not, it's breeding somewhere around your home, so you can deal with that quite easily just by turning over containers. If you find that you are doing this work and you're not seeing an improvement, then please give MRCU a call and we'll send a crew out to investigate the cause. Okay, I think I've already answered this next question. What specific type of mosquito transmits heartworm? And is it one of the species currently abundant? Yes, the main vector of dog heartworm is Ades and it is a mosquito we're currently seeing in the highest numbers. So please ensure that your pets, particularly your dogs, are treated for the dog heartworm.